nice put in a capsule everything we know about COPD. And as far as the biomass, thank you for emphasizing it. Yeah, I'm halfway around the world. Okay. Uh, can you hear? Mass as a cause of COPD. When we made a survey in Nueva Ecija, and since people were also smoking, the rate of COPD is even higher than in Metro Manila. So a lot of effort should be done to reduce biomass exposure. Also, there is this association of COPD and TB, whether this is just a recall bias or a real thing. I think it has to be studied. And of all the countries, maybe the Philippines is poised to do more of such studies, proving or disproving the relationship of COPD and tuberculosis. The problem of overlap syndrome you mentioned is really sometimes very difficult. And the recommendation is for the doctor to refer to a specialist, to the pulmonary specialist, because we do have important therapeutic considerations when there is just COPD, when there is just asthma, or where there is a real overlap, as you very well mentioned. Also, related to this is that, hello, can you hear me?
Yes. Yes, we can. Good.
Okay, okay. So, related to that last issue is that inhaled steroids with pure COPD may actually bring some harm, the occurrence of pneumonia. And that's why, as you mentioned, we do have choices that will be optimal for the patient, and we don't have to use corticosteroids all the time. And then the last thing I would like to give some word is the one you also emphasized, that those who are prescribing inhalers are really duty-bound professionally, morally, to also teach their patient how to use their inhalers. Because if the inhaler is not used properly, then, patients don't get well. They just spend money, and that's something really that has to be done in all clinic visits, whether it's their nth time to consult inhaler use, really, before actually going up the ladder and giving more medication. I guess that's it. Those who require oxygen, by the way, now we have very inexpensive, I would say cheap pulse oximeters from China. And I use them a lot. You just have to test that the product is functioning, and if they are functioning, then they can be as reliable as the US-made pulse oximeter. Anyway, this is US-made, copied by China. Okay, that's all for the moment. I hope you got all that.
Okay. Any more other reaction, Dr. Roa?
Sir, I'm actually looking at
I was actually looking at the goal 2015. They do recognize TB as a risk factor for COPD. That's something that's really an exciting thing to look into. As we said, we are one of the countries where probably can do all those researches in TB and COPD concurrence.
Yeah. Now, Ruth, so I have a question since Yvonne prompted me. You mentioned vaccination. It should really, really do. Now, for pneumonia, there is this advocacy now to give, for example, the pneumococcal vaccine just before the patient goes home, so that they will not forget to have. And it has been found that those who consulted or get admitted for pneumonia actually had a prior admission and they forgot all about the vaccine. Now, can we do that in a COPD who is recovering from an exacerbation, since these patients are still loaded with the oral steroids?
But I wouldn't really know the answer to that. Personally, as again, if you guys are still on steroids, you send them all still on steroids, you will assume that their immune system is not robust yet to give an immune system response. So I usually tend to give it 1 month after discharge when they're back to their stable state. Because these patients are usually your chronic patients who follow up with you, and I don't have a problem with them following it up and giving it as an outpatient. But me personally, I don't do it just before discharge because these are patients are still loaded up with a lot of steroids.
Thank you.
I guess with regards to pneumococcal vaccine, I'd like to ask Dr. Divina Gracia and Dr. Roa. There's these two preparations.
There's Reactor and the remote 23.
Which one do you give? Do you both?
Dr. Roa, what's your take on that? Which one do you give? The Pneumo 23, the Prevgan 13, or both? Or you follow the recommendation which to give both?
Yes, of course it will be both, but I usually start with the Prevnar, the conjugated vaccine, and the recommendation now of the expert committee in the US is to give the second one a year after. Almost the same as the other way around, whereas before, the move was to give the polysaccharide vaccine after 2 months, but they have simplified it to just 1 year at a time, starting with, I would start with the conjugated Prevnar.
Like to ask both would be, what are the most common when you're teaching the patient to use your inhaler, what are the most common that you notice?
Depends on which device you're using. The meter dose inhaler is sometimes number one. They cannot coordinate, and unfortunately, the older your patient, the harder it is for them. That's now you have now the powder devices, the crushable devices. In patients with very low inspiratory flow rate, meaning they cannot inhale, that's when unfortunately you have to consider using a nebulizer. But again, the coordination, whether they're clicking it properly, whether they're inhaling properly, whether they're holding their breaths. Now, you can actually look, you as a clinician can actually look at YouTube how to properly use this so that you can make sure your patients are using this. Dr. Roa, what are your other thoughts on making sure they're using their inhalers properly?
I also look at the YouTube and show it to the patient. Yeah, and
YouTube.
for NDIs, we also have these valve spacers that are, however, for better deposition, you need a bigger one. So it's quite cumbersome, but you just have to convince them that, especially those that we mentioned are quite having difficulty already getting good inspiratory flows, they would be better served with a valve spacer. And now we have also softer mist inhaler. I was mentioned that,
right,
as well as fine particle inhalers that are what I call them a little bit more forgiving, but they still have to be checked all the time.
From the audience for either Dr. Roa or Dr. Ruth?
from the
Divina Gracia.
audience?
You can send them in. Yeah.
Maybe you can also email
Your
to us
questions.
or text to us.
And